Hi, thank you so much for tuning into my session, Therapy on a Budget, How to Save Time and Money While Getting the Care You Need. My name is Jessica Smith, and I'll be presenting this content. A little bit about me. I am a Baltimore, Maryland native. I am a mental health advocate, a social entrepreneur, writer, and a mindful meditation instructor. I'm also the founder and director of the Mental Health Emergency Fund Incorporated. So what we're going to cover in this quick session is number one, how to identify your needs, learning the different providers that are available to you as you think about saving time and money, how to save money, so different resources to plug into when you're thinking about therapy. And thirdly, how to save time. So developing an actual process for screening potential therapists. That's something very important that I don't think enough people talk about. So I'm excited to dig in. So there are a lot of different mental health practitioners out there, mental health providers, mental health therapists, just mental health people in the profession. So psychologists actually have doctoral degrees. So these are the ones who have PhDs and can treat more severe mental illnesses, such as psychosis. More often than not, they are actually in the field doing research, which is why they have obtained their PhD. A lot of times they do have private practices, so you can see psychologists at a private practice and seek them that way. Psychiatrists. So psychiatrists actually are medical doctors who prescribe medication along with their treatment. So they actually have to go through 4 years of medical school, 4 years of residency, and their specialty is psychiatry. So they are an actual medical doctor versus a talk therapist. They can prescribe medication. Now, what is also something to note is that nurse practitioners can also prescribe this medication as well. So you might want to see a nurse practitioner who specializes in psychiatry. A therapist is a clinician who treats a mental health condition. That's a kind of a broad range for what a therapist is. A lot of times, therapy is used in a number of ways. So you can have an art therapist, a music therapist, a mental health therapist, a talk therapist, a sound therapist, right? So they treat mental health concerns. They often have master's degrees. So some common therapists are licensed clinical social workers and licensed marriage and family therapists. And then finally, counselors. So counselors actually focus on short-term, concrete, specific life changes. So addiction counselors, grief counselors, abuse counselors, pastoral counselors. These are counselors who are seeing you for a specific period of time. You might go to them with specific goals, and you may not be seeing them as much, and they might not be able to take your insurance. So all these things are really important to think about when you consider what your needs are and how you select a therapist. So very many ways to save money when you're thinking about therapy or seeking help. So the first thing I would encourage you to do is check with your insurance. What insurance do you have? What are their coverages? A lot of times you can call the number on the back of your card and ask what their behavioral health benefits are. You would want to find in-network providers because most often you would only have to pay a copay versus paying for the full session. You also want to check with your employer if you are employed. A lot of companies offer certain amounts of sessions in their benefits package through a particular employee resource group. And so just check with your employer to see if you have those benefits. You never know unless you ask. Third thing to do is ask about pro bono or sliding scale therapy with someone you might already be seeing. Maybe you've already kind of built a rapport with them, and you may be in a different financial situation. They know you, they know that you are reliable, consistent, you show up to your appointments, and maybe ask if they can, maybe put you on a payment plan, if they have pro bono rates or sliding scale, or even if you don't already have that relationship with them, see if there are any sites that provide that information. So Open Path Collective is a site that I definitely encourage you to do. If you live in Maryland, pro bono counseling is a site that I refer people in my network to. Community resources like the Mental Health Emergency Fund and Loveland Foundation, I'm sure there are plenty others, provide stipends for those who need support with therapy. So look into your local community resources to see if there are ways that provide you with low cost or free therapy. And then finally, how do you find a good fit? Now, I'm not saying that this is a specific A to F timeline or that you have to try all these things. Do what works for you. But I kind of wanted to put it in a way that was easy to kind of follow along. If I'm thinking about walking a person from very beginning to actually getting on the phone with a potential provider, right? So you want to know your needs. Know if you are wanting to see a psychiatrist, if you're wanting to see a counselor or a therapist, back to that first step. Know what your non-negotiables are. Maybe you want to see a Black woman, a Black man, someone in the queer community, know what your non-negotiables are. And then know the difference between a non-negotiable and just a preference. Sometimes we have a preference for something and realize that, oh, okay, this person, even though I really wanted this, they were able to meet me exactly where I was, and I was happy. So I've heard a few women talk about them having therapists who are men. I personally have never tried having a therapist who is a man, but maybe that can be something that I try in the near future, right? So just something to think about. I would definitely say to ask trusted voices. So maybe you have a referral from your primary care physician or your doctor who would be able to refer you to a therapist in their network or someone that they know of, someone who their clients see. Ask friends, family members who are in therapy who have great results. Ask those trusted voices, get that firsthand experience. That's definitely going to be great in terms of referrals. I would also say search a popular directory. So therapyforblackgirls.com, that is one of the first places that I send people who live outside of Maryland. If they live in Maryland, I definitely send them to my therapy directory. But therapyforblackgirls.com, Therapy for Black Men. There are also platforms I've seen online like Therapy for Black Moms, Therapy for Black Kids. So search those directories to really see what's out there. And when you're searching, read some reviews, see if there's ratings. Psychology Today is a trusted national website, and the American Psychological Association, they actually have to be listed on some of those websites. And so you can read the reviews, see what clients are saying about them. That's obviously a great strategy. And then you also want to potentially, use social media to your advantage, listen to interviews, check out what's happening on social media, what their following is like, how they're engaging with their followers. Maybe they have a podcast like Dr. Joy Bradford on Therapy for Black Girls. I hope I said her name right. She has a whole podcast. So find out what type of media they're putting out. Maybe they have a blog. See what content they produce, see if you kind of vibe with the personalities. Maybe they go on live on Instagram Live or Facebook Live. Really see kind of if they're going to be a good fit and if you vibe with them. And then the last thing I would say is to get on their schedule, do a free 15-minute consultation. Many therapists provide those free consultations so you can get their personalities through the phone, ask questions, and you're not committed, right? You're just kind of dating around until you find that good fit. It could take some time, but I definitely think it's worth it. So in conclusion, make sure you identify your needs, knowing the type of provider that you want, knowing your time and budget, do your homework, research all you can to find your best fit, and then trust the process. It will work out. If you are committed to the journey, it will work out for you. I am definitely sure of it. If you like this content, please follow me on social media, Mental Health Emergency Fund, that's Instagram. And then on my website, you can download a free giveaway of this content in article format. So website is www.mentalhealthemergencyfund.org, and you can download it there. Thank you so much. Take care.